Midday, King's College Hospital Emergency Department in South London.
If there is any tension here, it's recent comments from a government minister that the NHS is under sustainable pressure. Now, they are coping here at King's, but it is only autumn and they are virtually full. And there are other parts of the health service where they are already saying that they are at tipping point.
The second Thursday in the month is Data Dump Day. NHS England publishes the figures that give us a snapshot of how the health service is doing, and it's not doing very well. But here in the emergency department, it's not about what is happening right now, it's about their fear of what is going to happen.
Working with the executive at the hospital, everyone recognises that. I think the staff are anxious, but they come to work every day wanting to do a really good job for the patients in front of them. I think we're aware that we might not will always be able to spend as much time talking to patients as we might want to because we get pulled away to do other life-saving things. But ultimately we're determined to keep it as safe as we can for the people in front of us, but we are anxious.
What's making you anxious?
I think we're anxious about the number of patients coming through, and especially in an emergency department, whether there's going to be beds for them. We hear about crisis in social care and we hear about difficulties for patients to be discharged. And that means patients will stay longer in the emergency department waiting for a bed, which means I don't have a trolley or a nurse to help to care for that patient.
Social care. The staff shortages there are being felt right across the health service, leaving people well enough to go home stranded in hospital. COVID is still very much around too. Numbers have declined slightly, but at King's they say those patients take up the extra beds. Last month, the Health Secretary warned waiting lists would climb, and he was right. Today, data shows a record 5.8 million people were waiting for treatment in England by the end of September, and all the other numbers are climbing too. People waiting more than a year for treatment was up, 999 calls were up, ambulance call-outs were up to record levels. Patients attending major A&Es, they were the highest ever for October and the third highest since records began.
We're seeing pressure across the whole system, so it's not like we're seeing really difficult performance in A&E or really difficult performance in RTT or really difficult performance in cancer, for example. We're seeing that pressure across the board now, and that makes it really difficult to be able to absorb any additional pressure because there's no wiggle room, there's no space to move people around or do things differently.
Up on the surgical ward, the theatres are mostly booked out for today. As we get there, orthopaedic staff are working on an emergency. And they also have the routine lists to get through. They've reduced their one-year waits here from 8,000 to 1,000.
So all of our theatres are full all of the time, but what we've done is assess the needs of the patient. So we've looked at our service as a whole, and we're balancing emergency and elective care. We've also ended up standing up some extra lists on Saturdays to try and deliver care. We can't create a new theatre, and they're all full all of the time, Monday to Friday. So we're now moving on to Saturday working in order to address some of the backlogs that we're facing.
The message from the government today is that they have given the NHS more money, but they urge patients to help by getting their COVID and flu jabs. Yet there is a stronger message from elsewhere within the health service, with some asking, can patients be kept safe this winter?